One somewhere in the next few months or the next year or before the end of the decade, you are going to become eligible for Medicare. And somewhere around that same time, you are going to have to make decisions about supplemental coverage that will either protect you from thousands of dollars in out-of-pocket costs or leave you fully exposed to them. The agents most likely to approach you have a financial incentive to steer you toward a product that is not the most protective option available. The government agency that administers Medicare buries the most important deadline in 116 pages of handbook. Here is the fact that makes all of this concrete. According to a Kaiser Family Foundation analysis of Medicare current beneficiary survey data, the average Medicare beneficiary paid $6,330 out of pocket for healthcare costs in a single year. That is the average. For beneficiaries in traditional Medicare with no supplemental coverage at all, the exposure is uncapped. In the year this data was collected, 3.2 million Medicare beneficiaries had no supplemental coverage. That is not a risk most of them knew they were accepting. In most cases, it is a gap they never knew existed. By the end of this video, you will know the specific enrollment window that gives you permanent protection regardless of your health history, and exactly how long you have to use it before that right disappears. When you enroll in Medicare Part B, a 6-month window opens. During that window, any Medigap insurer operating in your state is legally required to sell you a policy at their standard premium, regardless of your health history, regardless of any pre-existing conditions. You cannot be charged more, you cannot be turned away. That window is called the Medigap Open Enrollment Period, and it begins the month your Part B coverage becomes effective. In most states, once that window closes, insurers have the legal right to medically underwrite you. They can charge you a higher premium because of your health history. They can decline to cover pre-existing conditions. They can refuse to sell you a policy at all. The Centers for Medicare and Medicaid Services, headquartered in Baltimore, Maryland, does not send you a notice when the window is about to close. The clock runs regardless of whether you knew it was running. A smaller number of states have extended guaranteed issue protections. California, Connecticut, New York, and a handful of others have state-level rules that give policyholders ongoing rights to purchase or switch coverage without medical underwriting. Most states do not. That structure benefits the insurance market and no one else. As of January 1st, 2020, Plans C and F were closed to new enrollees. Both were the most comprehensive plans available. The plan that comes closest to that same coverage level for new enrollees is Plan G. Plan G covers hospital coinsurance, skilled nursing facility coinsurance, the Part A deductible, and foreign travel emergency care. The one gap between Plan G and the no longer available Plan F is the Part B deductible, which is $283 in 2026. In most markets, the annual premium difference between the two plans exceeds that $283 deductible in the first year. New enrollees who are sold Plan F equivalent coverage through grandfathered policies are often paying more to cover a deductible that is smaller than the premium difference. Plan N carries lower premiums than Plan G, but adds cost sharing, up to a $20 copay for office visits and up to $50 for emergency room visits that do not result in an inpatient admission. For a beneficiary managing multiple chronic conditions with regular specialist visits, the premium savings disappear within 12 months. The break-even calculation requires knowing your own utilization pattern. The agent presenting you with Plan N options is not required to run that calculation for you, and most do not. As of early 2026, more than a dozen states have passed some version of what is called the birthday rule. Among the states with active birthday rule protections, California, Idaho, Illinois, Louisiana, Maryland, Nevada, Oregon, Kentucky, Oklahoma, Utah, Virginia, Wyoming, Indiana, Rhode Island, and Delaware. The specifics vary by state, but the core protection is the same. Once per year, during a window tied to your birthday, you are permitted to switch to an equal or lesser Medigap plan with a participating insurer without medical underwriting. The insurer cannot charge you more based on your health history. The birthday rule exists in state insurance regulations, not in any document Medicare sends you, and it is not disclosed in most insurer enrollment materials. It must be asked for directly. The household discount follows the same pattern. Most Medigap insurers offer a premium reduction of 5 to 12% when two members of the same household enroll in plans from the same company. The discount amounts to between $200 and $800 annually, depending on the plan and the insurer. It is almost never volunteered in the enrollment conversation. It must be specifically requested. That is not an administrative coincidence. That is a business model. If someone in your family is approaching Medicare enrollment or is already enrolled and has never seen any of this laid out clearly, this channel covers the financial architecture of Medicare and senior care systems in exactly this depth every week. Subscribing means they will not have to find it after a gap has already cost them. I have looked at a lot of these enrollment materials, and the document that appears in almost all of them is the one that lists plan names without explaining what happens if you wait to buy. The comparison tool at Medicare.gov shows every plan and insurer available by zip code. It is free. The State Health Insurance Assistance Program, a federally funded counseling network, offers free one-on-one guidance from counselors who are not paid commissions and have no financial stake in which plan you select. The birthday rule is codified in state insurance regulations accessible to anyone. None of this information is hidden in the sense of being classified. It is hidden in the sense that nothing about the default enrollment path is designed to surface it. The part of this that most people miss is not that the system is complicated, it is that the complexity is not evenly distributed. The information that protects buyers requires active research to find. The information that benefits insurers is baked into the default path. When the most consequential decision a Medicare beneficiary makes is buried in the middle of a handbook longer than most legal contracts, that is a design choice. That same beneficiary, the one the handbook was formatted for, enrolled in Medicare, never saw the window open, and found out it had closed when they tried to buy coverage 2 years later and received a premium quote 60% higher than the standard rate. Everything before this point is what the enrollment system is designed to move you past without stopping. What follows is the specific process for making sure you are not the beneficiary who finds out too late. First, identify the first date your Medicare Part B coverage is effective. Set a reminder for 150 days after that date to begin comparing plans, not at the deadline, but with runway to evaluate options without pressure. The Medicare.gov Medigap comparison tool, searchable by zip code, shows every plan and insurer in your market and is not affiliated with any insurer's sales process. Second, contact your state's State Health Insurance Assistance Program counselor before signing anything. The national directory is at shiphelp.org. SHIP counselors are federally funded and not paid commissions. The consultation is free and covers every option relevant to your specific situation. Third, check whether your state has a birthday rule by searching your state's name and the phrase Medigap birthday rule. The list of states has expanded significantly in recent years. If your birthday has not passed yet this year and your state has this protection, you may be able to switch to a lower premium plan with equivalent coverage before the window closes. Fourth, ask every insurer you contact whether a household discount is available and what the percentage is. Do not wait for it to be volunteered. Fifth, before selecting between Plan G and Plan N, count your specialist and emergency room visits from the previous year and run the premium difference against $20 per visit. The math takes 10 minutes and determines whether Plan N's lower premium actually saves you money or costs you more at your utilization rate. The complete protocol takes 3 to 5 hours, spread across a few weeks. The potential premium savings from the birthday rule, household discounts, and correct plan selection can exceed several hundred to several $1,000s annually, every year you are enrolled. Before this video, you were someone the Medicare enrollment process was designed to move past the most consequential coverage window without fully explaining what it was. You had no reason to know that more than a dozen states now have birthday rule protections, that SHIP counselors are free and in every state, or that the difference between Plan G and Plan N is a math problem with a specific answer based on your own utilization history. That framework now belongs to you. If you are currently navigating any of this and something in what you just heard matched a situation you are currently navigating, share it in the comments, because you are not the only one, and your experience is evidence. Every video on this channel is built around one principle. Your family deserves to know how this system actually works before you are inside it. Subscribe so the next investigation reaches you in time to use it.